Heading out to give you a short intro into what I consider currently to be probably the hottest topic in contemporary body contouring surgery, which is minimally invasive remodeling of the ribs. There's different trade names for this. We call it RibMold. You will find rib scar, wasp, reboss, and an endless array of techniques, which is fine. You know, there's a few technical modifications, but in the end of the day, what we want to do is remold, reshape the ribs without removing them, because the hourglass waist, the defined, the accentuated waist is probably objective number one in our patient community. And this is something that in the majority of cases, you know, with diet and exercise, you simply can't achieve. That is unfortunately an illusion. Even if you have fat, this fat alone will not define your waist. I mean, it contributes without doubt, but the rib cage, you know, the bony build contributes significantly. So what I'm showing here is a case where we did one of our famous Brazilian butt lifts together with rib remodeling. And I think it's easy to see the effects of these surgeries complement each other. The result is much more impressive and drastic when you combine these procedures, as you see here. So it's what we call a result booster. You get much more out of your surgery if you do it together for those who want a really very accentuated waist. So what are we doing? We are basically reshaping the lower floating ribs. The lower floating ribs have no impact on the stability of the thoracic cage. We basically do a so-called monocortical fracture. In other words, we do not break the rib completely, but we just break the outer surface, with having the huge advantage then the rib itself stays there. It might have a protective function for your lower thoracic cage, and it's not removed. And as you can see here, that's again a combo case. It adds a significant punch to body contouring, a Brazilian butt lift surgery, and significantly enhances the results. So what is really the key difference between rib removal and rib remodeling is rib removal will remove the rib. That is something that can be done. Now, every surgeon has come to his own conclusions or her own conclusions. My take is I think it's perfectly possible to do it. It might be a good operation for some, but removing the rib, as many opine, is of course a much more traumatic procedure. Our main doubt is potential loss of a protective layer of the lower thoracic cage. So we really, in our practice, really prefer to keep it with RibMold for the time being. Basically, there is not really scarring because we do that with a so-called piozotome. That's a very fine instrument that we can bring in through a needle incision. So you see there is no real scarring, it's just the needle stab incisions. And again, you see here a case of fat reshaping of the buttock together with rib remodeling, and the results, as you can see, are pretty impressive. How's it done? There are people doing it under local anesthetic. I mean, if it's rib remodeling alone, I personally would not really be very keen on anybody doing that on me. But it can be done. We usually prefer a short general anesthesia. You have a needle stab on the side of your torso. We find the kinking point of the rib. We produce with a fine instrument, the piozotome, we produce a partial fracture just of the outer surface of the rib. There's no cuts, there's no sutures. So it's basically just like a needle stab. The catch, we depend on the patient cooperating with the corset. If the patient doesn't wear the corset, you will not really have a result. So it's a bit of teamwork, you know. It's patient surgeon working together here to prevent the patient. Whereas the corset, the results can be very nice. So what we do, we reshape the bony structure, and we usually, in most cases, actually do it together with liposuction, liposculpture in a combo, and that gives a very nice accentuated waist and a good aesthetic waist to hip transition. You see here, that's a case of a, let's say, thinnish patient, but you see the power of this combo. She has rib remodeling plus buttock implants and BBL, and is having a good starting point, but a very, very impressive change. So very, very nice. And that's a good technique for patients with these preconditions. So again, you know, it's not really any scarring you have to worry about. It's more, you know, wearing the corset. That's something that is important. The majority of patients don't really complain about too much pain. It is possible on selected occasions. It can be a bit painful, which we try to mitigate as much as we can. But it's not like breaking a full rib. You know, when you fall off your bike and you break the full rib, that is much, much more painful. Really, the bottleneck is here that the patient must wear the corset. I'm showing you another case with a very, very good indication for this. And this makes a big, big volume in my practice. Patient had 2 BBLs elsewhere before.